medical conditions. Today we'll be discussing cholera. You are with me, Liviness Michoga, the presenter and the editor of the program. And I'm also with Mr. Gift Josam, who is the IDCR coordinator at Moreland District Hospital. Welcome, Mr. Josam.
Thank you very much. Indeed, I'm IDCR coordinator. We always look at the outbreak like cholera and other conditions.
Thank you. All right. Now, Mr. Josam, can you tell us the overview of cholera?
Actually, cholera is an outbreak. Most of the time it follows it during the time of droughts, when there's natural disasters or during conflict. This time around, we always experience cholera. And in overview, the statistical figures reveal that 1.3 million cases to 4.0 million cases annually they get encountered in the endemic areas. Like in our countries, in Malawi, in one of the endemic areas. And most of the time, this condition is always caused by the bacteria, what we call Vibrio cholerae. So we'll be much more talking about those kind of cholera as we go along with our discussion.
All right. Now, Mr. Joseph, what are the causes of cholera?
As I was saying during the overview, that this is bacterial infection. It is caused by the bacteria called Vibrio cholerae. There are three types of Vibrio cholerae. Okay. Number one is Vibrio cholerae, which is the main cause, and the Vibrio cholerae of the type like 01. 01 is the most common serogroup. That shall imply that it is the most bacteria that causes this kind of the disease, the cholera. Okay. And the number two is Vibrio cholerae of strain of 0139, which is the emergency strain. Right. Yes, so those are the three types of the Vibrio cholerae that causes the cholera.
All right, listeners, I think we need to pay much attention to this medical condition. Okay, Mr. Josam, so how is these bacteria transmit? How can someone catch these bacteria? Can you tell us what happened exactly?
You can catch this bacteria by the following ways. Number one, when you have got ingested contaminated water. When the water has been contaminated with the Vibrio cholerae, you are likely to catch the cholera, because in that case, that means you have ingested the actual or the thing that causes cholera. In so doing, the likelihood of catching the infection is high. So, number one thing is contaminated water. Number two is ingesting food that has got the Vibrio cholerae of nature. That can be 01 or other type of strains. So those kind of foods can be especially the seafoods, the foods that most of the time they are found in water. The fruits that we always eat as dairy foods or as other as we do consume them in one or another, like mangoes, pawpaws. When we haven't washed them correctly, following the protocols, the likelihood of catching the infection is high when those kind of fruits have been contaminated with the Vibrio cholerae. And again, the vegetables, we always buy vegetables like mustard, in vernacular we say the piro and the other kind of vegetables. So if those kind of vegetables have been contaminated with these Vibrios, if we haven't washed them clearly, the chances of getting the infection is high, and because it's like we have ingested the causative agent of cholera, which is Vibrio cholerae. Okay. And another transmission is fecal-oral route. Fecal-oral route, we are saying that we have we have ingested the fecal matter of the individual who is having cholera. In that case, for sure, we have to know that the cholera again, it can reside in the fecal matter. So the person has defecated somewhere else or not in the toilet, the likelihood of catching the infection is high, especially when that person has got the bacteria that causes cholera, which is Vibrio cholerae. So fecal oral it goes together with hygiene. If you are not following hygienic order like hand washing or hand sanitization, then the chances of getting the infection is very high again, because failure to wash hands is like we are harboring the infection in our hands. So if we catch or if we tend to shake hands with our friend, it's like we are sharing the infection, especially to those people who have got the bacteria that causes the cholera. In this case, we are talking about Vibrio cholerae, specifically the 01 strain, which is very common in our situation, that is Malawi. And again, the issue of sanitation. On sanitation, we are talking of the toilets. We need to know how to use our latrines properly. We need to have latrines that are being used. We can have latrines, but failure to use them is another case. We need to have latrines and we need to use them thoroughly so that we are not defecating anyhow and anywhere. Because defecating anyhow and anywhere to the extent that people who are defecating anyhow somewhere, they have got Vibrio cholerae, the chances of transmitting is very high. As such, sanitation must be well observed. Another thing is person-to-person contact. In this case, as I said already, that this can happen during hand washing or even handshaking, rather not hand washing, but should be handshaking. If you haven't washed our hands thoroughly, and it happens that in our hands we have got the bacteria that causes the Vibrio, we are likely to transmit it to our friends. And so doing, the transmission is there. Again, contaminated surface and objects. In this case, we are talking of in our setup, like the door handles, even in our offices. If it happens that in our hands we have got the Vibrio cholerae, then you handle the door, even other surfaces, and our friend who is clean tend to touch again those kind of things. The chances of transmitting, they are very high. So in a nutshell, that's what I can say about the transmission of this cholera. Of course, there are a lot. However, these are the major things that we consider them as the transmission factors of cholera.
All right. As Mr. Joseph has said, our listeners, we need to have toilets. Let's have toilets at our homes and avoid using the bushes as our toilets. All right, Mr. Joseph. Now, what are the risk factors?
Risk factors, there are a lot of risk factors for this cholera. Number one is to travel in an endemic area. When you say endemic area, we mean that the area that has got Vibrio cholerae. For example, when Jigwao has got an outbreak of cholera, if you travel to Jigwao, you are at a very high risk of catching the cholera, because it's like endemic area, and those bacteria, they are anyhow, and the people there, they are at a very high risk. In the similar way, the one who is traveling there, again, him or her is putting herself on a risk of catching the bacteria which causes the Vibrio cholerae. Yes. So that's number one thing. And number two is the lack of clean water. This is waterborne disease. As such, if the water is not treated well, using the very good mechanism, in this case we are talking of chlorination, we need to chlorinate our water using even water guard or we can boil. However, boiling is an ordinary thing, but as of now, we encourage the community to apply their water using water guard or chlorine 0.5%. That's the way we are supposed to treat our water. If you like those kind of water, we are predisposing ourselves to cholera. And another one is poor sanitation and hygiene. And this one has got and as I said, is a waterborne disease. If sanitation is not okay and hygiene is not okay, the chances of transmitting is very high, because the Vibrio cholerae most of the time is well harbored where sanitation and hygiene is not well observed. In addition, where we have got crowding and poverty, where the poverty is, people they just pick anything that they wish to eat. In this case, in terms of droughts, during droughts, the community can just pick anything. They think they can help themselves to feed themselves. Like they can just pick any fruits without washing. They can just get water from an reliable source, resulting into nothing but catching the Vibrio cholerae, which will cause cholera. So doing those guys, they are at risk of catching the disease. In this case, we are talking of cholera. Another predisposing factor is weakened immune system. Where the immunity is weak, expect this kind of infection to take advantage of weak immunity. In so doing, the individual will not have the immune competent enough to fight against the Vibrio cholerae, which causes the cholera. As such, the person can easily catch the infection and get sick. In addition to that, malnutrition. Malnutrition is a very, very bad thing as well in the video, whereby when our nutrition status is not well okay, then our immune system get lower. When it is lower, for sure we expect nothing but immunocompetent becomes low, hence the disease will take advantage of those kind of parameters, resulting into nothing but catching the infection, which might result into the cholera. Those are some of the predisposing factors that may result into cholera. Sure.
All right. In case you're just joining us, listeners, today we're discussing cholera. Our guest is Mr. Gift Josam. So far, we've discussed the overview of cholera, what causes cholera, transmission, and risk factors. Now, does this disease have signs or symptoms? Mr. Josam.
Obviously, each and every disease has got signs and symptoms. Of course, they are very similar in each and every disease, but for cholera, we much more dwell on the following clinical presentation. Number one presentation is diarrhea. Diarrhea, by simple definition, we are talking about watery and confused fecal matters discharged by individual who has got cholera. Most of the time, the patient cholera, they exhibit with diarrhea, and this diarrhea is described as watery milk discharge, watery milk diarrhea. It looks like milk like so. So, of course, either they call it milk or like in vernacular we say maziampunga. It looks like maziampunga. The diarrhea itself, it looks like maziampunga, or which in borrowing language of English we say it's a watery milk fecal matters being discharged by this kind of patients. Sometimes they may exhibit vomiting. Vomiting is another clinical presentation, and